Hi friends, this is Dr. Abdequaem Chimthanawala. Today let us understand a very important remedy that we have been using in this pandemic, but few symptoms which I have found very useful in this pandemic, and I have used this remedy in treating those cases having these type of symptoms. A very important symptom that I've seen and have got good results in my practice. The remedy which I'm talking about is arsenic album. In arsenic album, I have seen that there is when the larynx is involved, there is catarrh, and it is very sudden. The patient says, "Yesterday night I was okay, and today the catarrh has started." The first symptom in acute cases in larynx, this symptom is very important about arsenic album. There is sudden catarrh, and there is constriction. This is a very important symptom I have seen in my practice. In these cases, there is constriction of the larynx after drinking. This is a very important symptom. You have to remember arsenic album, and one remedy which is very close to arsenic album is mephitis. That is constriction in the larynx after drinking. So arsenic album and a very rare remedy, that is mephitis. Next, as you go further, there is a sensation. It's a very important sensation in the larynx that you must remember, and the patient will also come and tell you, that is sensation of smoke in the larynx, or you can just smoke sensation, घुटन हो रही है, ऐसी पूरा धुआं लग रहा है larynx में. That is a sensation that a patient will come and tell you about arsenic, and you have to compare this arsenic with very important remedy, that is bratacarb and bromium. These two remedies also have the same sensation of smoke. Again, as you go further, the cough. Now the cough of arsenic, you must have read lots in Mater Medica, but this symptom I have found very useful. The cough basically of arsenic is aggravation during company. When you go to visit an arsenic album patient, and then he says, "Sir, whenever everybody is around, I start getting cough. When nobody is there, I don't get cough." Immediately think about arsenic. Either you can think about arsenic, you can think about abraxasia, you can think about bratacarb also. These three remedies has a very important symptom, that is cough, aggravation in company. This you will see when you go for home visits or hospital visits in this pandemic. Next, the cough basically is deep, and it is especially after midnight. It's a deep cough coming from deep inside, especially after midnight. So this is regarding the cough, regarding the larynx symptom. Now in cough, you have to always remember that in arsenic album, hot application ameliorates the cough. Hot application ameliorates the cough. Now this is important because this is a very important modality of arsenic album, that is hot application ameliorates the cough. Now with this modality, it's a very common modality for quite a few number of medicines. One of them is arsenic, but with that you have to remember few other drugs like Hiparsulf, Lycopodium, Phosphorus, Rustox, Rumex, also Silicia, where hot application ameliorates. It is also given in warm fluid ameliorates. So whenever something warm comes, because it's arsenic is chilly patient, so warm fluids or hot application amelioration I have found very useful in these pandemics. Now the expectoration. The expectoration of arsenic album is also very important. That is, in arsenic, the cough is loose expectoration with the daytime. Now this is important because in our homeopathy there are a lot of remedies which have expectoration in the morning, in the evening, in the night. Though it appears that the remedy is dry cough, but expectoration is a particular modality. So it is arsenic with daytime. Chamomilla is there, Hiparsulf is there, Pulsatilla is there. Very important. Pulsatilla, I think Silicia is also there, and sulfur is also there. This is important because if you get the modality right, you will definitely get the remedy right. Now, one more thing which I have seen very common in case of arsenic patients is, whenever the arsenic patient tells you that when I'm reading, I'm studying, I'm thinking, doctors say when I'm in my clinic, and whenever there is mental exertion, the cough starts. This is a very important symptom of arsenic, and very close to arsenic is Nexomica. There are about 3-4 remedies, but these two remedies are very useful. The patient comes and tells you that whenever I'm reading, whenever I'm studying, whenever I'm using my brains, the students comes and tells you, whenever there is mental exertion, not regarding studies, maybe regarding the career, regarding anything, but when there's a mental exertion, the cough starts, and that becomes a very, very important symptom of either arsenic album or nux. Now, again, if you go, as I've told you, the cough is basically in and around midnight or after midnight. Now, the smoke sensation which is present in the larynx is also present in the trachea. This again is a very, very important symptom of arsenic album. And in arsenic album, because of the smoke filling the trachea and larynx, the cough definitely becomes very suffocative. So there's a very suffocative cough after midnight. And with this, you have to compare arsenic with either Sambucus nigra, a very, very important remedy for suffocative cough after midnight. Or you can think about Kalikaram, the same symptom, suffocative cough after midnight. But the differentiating feature of the suffocative cough of arsenic album is very, very important, and that is suffocative cough on walking. When the patient walks, there's a lot of suffocative cough. So again, these cases, if you go in the hospital and the patient walks and these guys get suffocative cough, you have to think about arsenic. Of course, there are a lot of other things which are like we have dry tickling cough, we have sulfur fumes type cough, lot of them. But this symptom which I am telling you I have seen in my practice, one more symptom that I told you about is warm fluids ameliorate. Now, warm fluid ameliorate, you have to remember the medicine because the patient can come and tell you, Dr. Saab, जब भी खांसी आती है तो मैं गर्म पानी पी लेता हूँ, I drink hot water, or मैं चाय, I drink tea, anything warm. So warm fluid ameliorates the cough. If this symptom is present, though it is common, but very, very important, you have to know at least 4 or 5 remedies that have this modality. And write down if you don't know, that is arsenic album, Lycopodium, Nux vomica, Rustox, Silicia. Very, very important. We call it 3 marking remedies where warm fluid ameliorates the cough. Arsenic, Lycopodium, Nux vomica, Rustox and Silicia. Very, very important. And also you have to compare this with Bryonia alba and Spongia tosta. So this is a very, very important modality you have to remember in these cases or in these remedies. Now, the type of expectoration, this is also important because if the pandemic, if the COVID case advances and the patient start getting expectoration of bloody, spitting of blood, especially in the night. If there is spitting of blood, especially in the night, you must think about arsenic album. Of course, you have remedies like ferrum also, ferrum metallicum, pulsatilla, rustox also. There is spitting of blood, especially in the night. One more symptom that is I have seen in my OPD about arsenic album is expectoration bloody, spitting of blood, recurrence against arsenic album, Nux vomica and sulfur. So this is basically what I have seen in my practice. When the COVID advances also, you can think about arsenic if this symptom is present. Of course, in arsenic album always, most of that time you have to remember that the expectoration, with the patient expectoration, it is painful. So painful expectoration also, you can have arsenic, you can have natrum muru, you can have Lycopodium, you can have lachesis. These all have painful expectoration. And sometimes if it is not bloody, always you can't have bloody expectoration. So in sometimes if there is not bloody expectoration, it has not reached that stage in the pandemic, in arsenic album, in the first 1 or 2 days or 2 or 3 days, the expectoration is like saliva. पेशेंट बोलता है मुंह से थूक निकलने के समान खांसी से बलगम निकलता है. So expectoration like saliva. Remember arsenic album, remember thuja, remember medorinum and mercury. So you have to remember basically at least 3-4 remedies so that you can compare this with arsenic album. And lastly, the taste. Whenever expectoration comes out, the taste in arsenic album is so very important. And as you know, the taste in arsenic album expectoration is milky. Very, very important. Milky, you have to compare that with phosphorus and sulfur. Of course, you might have read in your Butter Medica, sometimes the expectoration tastes like onion. And that is also arsenic album. मतलब ऐसा लगता है कि प्याज खा लिया. It tastes like onion. So, but a very, very important remedy you have to compare with arsenic album is asafoetida. In fact, asafoetida comes before arsenic alb. It is very important. Then arsenic alb, you can think about petroleum and you can think about sulfur. So of course, then there is a lot of weakness because of fever. Sometimes the weakness is out of proportion because of the fever. That is also arsenic. So we are only concentrating on the respiratory tract, the larynx, trachea, cough, chest, and the expectoration. So this is in short something I have seen in my practice. मैं practice में देखा हूँ कि arsenic के symptoms ये आए इस pandemic में. So my dear friends, if you like the video, do share and subscribe. Thank you.